Question 1. According to the NMC code, what is the primary responsibility of a registered nurse when providing care? A. To ensure the hospital meets its financial targets. B. To prioritize the interests of the healthcare employer above all else. C. To make the care of people your first concern, treating them as individuals and respecting their dignity. D. To delegate all complex tasks to junior staff to manage workload. Answer: C. To make the care of people your first concern, treating them as individuals and respecting their dignity. This question tests your understanding of the core principles of the NMC code, specifically the first and most fundamental standard. The key phrase, primary responsibility, directs you to the most important duty. The NMC code states that nurses must always put the people in their care first, valuing them as unique individuals and upholding their dignity, which involves providing person-centered care. For example, before any procedure, a nurse should explain it clearly to the patient, obtain their consent, and ask if they have any questions or concerns, rather than simply rushing through. Always remember that your professional duty begins and ends with the well-being and respect of the individual receiving care. Question 2. A patient asks a nurse for information about their diagnosis and treatment plan. Which of the following is the most appropriate action for the nurse? A. Tell the patient it is not the nurse's role to provide such information. B. Provide general information but advise them to ask the doctor for specifics. C. Explain the diagnosis and treatment plan fully, using clear and understandable language. D. Ask the patient why they need this information before deciding what to share. Answer: C. Explain the diagnosis and treatment plan fully, using clear and understandable language. This question focuses on effective communication and patient advocacy, a crucial aspect of the NMC code. The important keywords are most appropriate action and information about their diagnosis and treatment plan. Nurses are legally and professionally obliged to provide clear, accurate, and understandable information to patients to help them make informed decisions about their care, acting as an advocate. For instance, if a patient asks about their new medication, you should explain its purpose, how to take it, and potential side effects in simple terms, rather than just referring them to the doctor. Always empower patients by ensuring they have the information they need about their health. Question 3. What is the fundamental purpose of maintaining accurate and contemporaneous patient records? A. To impress auditors during inspections. B. To protect the nurse from legal action in case of error. C. To ensure continuity of care, facilitate communication, and provide a legal record of interventions. D. To justify the nurse's workload and staffing levels. Answer: C. To ensure continuity of care, facilitate communication, and provide a legal record of interventions. This question assesses your knowledge of record-keeping principles, a critical component of safe and effective nursing practice. The keyword fundamental purpose emphasizes the core reasons for maintaining records. Accurate and contemporaneous, meaning at the time the event happened, records are essential because they ensure that all healthcare professionals involved have up-to-date information, preventing gaps or duplication in care, which also serves as a legal document. For example, documenting a patient's vital signs and the time they were taken allows the next nurse on duty to quickly assess changes in the patient's condition and take appropriate action. Always remember that good record-keeping is about patient safety and accountability, not just administrative tasks. Question 4. A nurse witnesses a colleague providing unsafe care. According to the NMC code, what is the nurse's immediate responsibility? A. Report the colleague to the manager immediately. B. Address the issue directly with the colleague and offer advice. C. Document the incident and monitor the colleague for future unsafe practice. D. Challenge the practice, intervene, and escalate concerns if necessary, to protect the patient. Answer: D. Challenge the practice, intervene, and escalate concerns if necessary, to protect the patient. This question delves into professional accountability and the duty to raise concerns, a vital aspect of patient safety outlined in the NMC Code. The key phrase "immediate responsibility" highlights the urgent need for action when patient safety is at risk. Nurses have a professional duty to challenge unsafe practice, intervene to protect patients from harm, and escalate their concerns through appropriate channels if the issue is not resolved. For example, if you see a colleague about to administer the wrong dose of medication, you must immediately speak up and stop the action to prevent patient harm. Always remember that your primary duty is to protect patients, and this includes challenging unsafe practices, even if it feels uncomfortable. Question 5. Which of the following actions demonstrates effective infection prevention and control in a clinical setting? A. Wearing the same pair of gloves for multiple patient contacts to save resources. B. Washing hands with soap and water only when visibly soiled. C. Adhering to the 5 moments for hand hygiene protocol. D. Using alcohol-based hand rub as a substitute for hand washing after caring for a patient with Clostridioides difficile. Answer: C. Adhering to the 5 moments for hand hygiene protocol. This question tests your understanding of fundamental infection prevention and control practices. The keyword effective points to the most impactful action for reducing the spread of infections. The 5 moments for hand hygiene: before touching a patient, before clean/aseptic procedure, after body fluid exposure risk, after touching a patient, and after touching patient surroundings, is a globally recognized standard that significantly reduces healthcare-associated infections. For instance, washing your hands after removing gloves, even if they aren't visibly soiled, is crucial because gloves can have microscopic holes. Remember, consistent and correct hand hygiene is the single most important action to prevent the spread of infection. Question 6. A nurse is caring for a patient who is unconscious. How should the nurse obtain consent for essential care interventions? A. Assume implied consent since the patient is unconscious. B. Seek consent from the patient's next of kin or legal proxy. C. Delay care until the patient regains consciousness to give consent. D. Proceed with care without consent, as it is an emergency. Answer: B. Seek consent from the patient's next of kin or legal proxy. This question focuses on the principle of consent, particularly when a patient lacks capacity. The keyword unconscious indicates that the patient cannot provide consent themselves. In such situations, healthcare professionals must seek consent from a legally authorized person, such as the next of kin or a legally appointed proxy, for non-emergency care. However, if the intervention is immediately life-saving and there is no time to seek consent, the healthcare team can proceed under the principle of necessity. For example, if an unconscious patient needs a urinary catheter, the nurse should discuss this with the patient's family and obtain their consent, rather than just assuming it. Always remember that even when a patient lacks capacity, the principle of involving someone in their best interests remains paramount. Question 7. According to the NMC Code, what is expected of a nurse regarding their own health and well-being? A. Nurses are expected to work regardless of their health status to maintain staffing levels. B. Nurses must manage their own health to ensure it does not affect their fitness to practice. C. Nurses should avoid discussing their health with anyone, including their employer. D. Nurses are exempt from general health and safety guidelines applicable to other professions. Answer: B. Nurses must manage their own health to ensure it does not affect their fitness to practice. This question assesses an important aspect of professional accountability: maintaining one's own health. The keyword expected highlights a professional requirement rather than an option. The NMC Code mandates that nurses must maintain their own health to ensure they are fit to practice, meaning their physical or mental health does not compromise the safety or quality of care they provide. For example, if a nurse develops an infectious illness, they must report it and refrain from working to prevent spreading it to vulnerable patients. Taking care of your own well-being is not just a personal choice, it's a professional responsibility to protect the public. Question 8. A nurse is preparing to administer medication. What is the most crucial step the nurse must perform before giving any medication? A. Check the expiry date of the medication. B. Ensure the patient has eaten recently. C. Verify the 5 rights of medication administration. D. Ask another nurse to double-check the medication. Answer: C. Verify the 5 rights of medication administration. This question tests your knowledge of safe medication practice, a high-stakes area of nursing. The keyword "most crucial step" directs you to the most fundamental safety check. The 5 rights, right patient, right drug, right dose, right route, and right time, are the cornerstone of medication safety and must be confirmed meticulously before every administration to prevent errors. For example, before giving an antibiotic, you should confirm the patient's identity, that it's the correct antibiotic, the prescribed dose, the correct administration method, e.g., oral, and that it's due at that specific time. Always remember that adhering to the 5 rights is non-negotiable for patient safety when administering medication. Question 9. In the event of a cardiac arrest, what initial assessment framework should a nurse follow? A. DRABC, danger, response, airway, breathing, circulation. B. ABCDE, airway, breathing, circulation, disability, exposure. C. SBAR, situation, background, assessment, recommendation. D. ISABAR, identify, situation, observations, background, agreed plan, read back. Answer: B. ABCDE, airway, breathing, circulation, disability, exposure. This question tests your knowledge of the immediate response to a critically unwell patient, a fundamental aspect of basic life support and acute care. The critical phrase cardiac arrest, or acutely unwell in general, signifies a medical emergency requiring a systematic assessment. The ABCDE approach is a structured, prioritized system used to assess and manage critically ill patients, ensuring that life-threatening problems are identified and treated quickly. For example, checking the airway, A, is the first step, as an obstructed airway is immediately life-threatening. Always remember that a systematic approach like ABCD helps you prioritize interventions and manage emergencies effectively. Question 10. A nurse overhears 2 colleagues discussing a patient's confidential medical information in a public area. What action should the nurse take? A. Join the conversation to understand the context. B. Ignore the conversation, as it is not the nurse's concern. C. Politely remind the colleagues about patient confidentiality and suggest moving to a private area. D. Report the colleagues to the NMC immediately. Answer: C. Politely remind the colleagues about patient confidentiality and suggest moving to a private area. This question addresses the crucial principle of patient confidentiality and professional conduct. The keyword overhears and public area highlight a breach of privacy. The most appropriate immediate action is to discreetly and politely intervene to stop the breach and educate your colleagues, reinforcing the importance of privacy, while escalating if they continue or if it's a recurring issue. For instance, you might say, "Excuse me, could we perhaps discuss this in a more private setting?" Confidentiality means that patient information should only be discussed when necessary and in appropriate, private environments. Always remember that protecting patient privacy is a fundamental ethical and legal duty. Question 11. What is the primary purpose of obtaining informed consent from a patient before a procedure? A. To protect the healthcare provider from legal action. B. To ensure the patient fully understands and voluntarily agrees to the proposed treatment or intervention. C. To speed up the clinical process by getting quick approval. D. To allow the hospital to charge for the procedure. Answer: B. To ensure the patient fully understands and voluntarily agrees to the proposed treatment or intervention. This question focuses on the ethical and legal principle of informed consent, which is central to patient autonomy. The keyword primary purpose directs you to the core reason behind this process. Informed consent means that a patient must be given all relevant information about a proposed treatment, including its benefits, risks, alternatives, and consequences of not having it, so they can make a voluntary decision. For example, before administering a vaccine, a nurse must explain what the vaccine is for, potential side effects, and answer any questions the patient might have before they agree to receive it. Always empower patients by ensuring they have the information they need to make choices about their own care. Question 12. Which of the following is an example of professional accountability for a registered nurse? A. Only working the minimum required hours each week. B. Admitting a medication error and reporting it according to hospital policy. C. Refusing to care for a patient whose views differ from their own. D. Delegating all personal care tasks to healthcare assistants. Answer: B. Admitting a medication error and reporting it according to hospital policy. This question tests your understanding of professional accountability, a cornerstone of safe and ethical nursing practice. The phrase professional accountability refers to taking responsibility for one's actions and decisions, including mistakes. Admitting a medication error and following reporting protocols demonstrates accountability, as it prioritizes patient safety, allows for investigation to prevent recurrence, and upholds the duty of candor. For instance, if you accidentally administer an incorrect dose, you must immediately assess the patient, inform the prescriber, and complete an incident report to ensure proper follow-up and learning. Always remember that accountability involves transparency and learning from errors to improve patient safety. Question 13. When communicating with a patient who has a hearing impairment, what is the most effective strategy for a nurse? A. Shout loudly to ensure the patient can hear. B. Speak quickly to get all information across efficiently. C. Speak clearly, face the patient, and use visual aids if helpful. D. Write down all information, as verbal communication will be ineffective. Answer: C. Speak clearly, face the patient, and use visual aids if helpful. This question focuses on effective communication skills, particularly with patients who have sensory impairments. The keyword most effective strategy highlights the best approach for clear communication. Speaking clearly, facing the patient, and using visual aids, like gestures or written notes, helps the patient to lip read, observe facial expressions, and comprehend the message, promoting understanding and respect. For example, if explaining a procedure, you might speak slowly and clearly while pointing to a diagram. Always remember that adapting your communication style to individual needs ensures that all patients feel heard and understood. Question 14. What is the purpose of the NMC revalidation process for registered nurses? A. To retest nurses on their clinical skills every 3 years. B. To ensure nurses remain fit to practice and continue to meet professional standards throughout their career. C. To determine if a nurse is eligible for a promotion or pay rise. D. To allow nurses to take an extended break from practice without losing their registration. Answer: B. To ensure nurses remain fit to practice and continue to meet professional standards throughout their career. This question assesses your knowledge of the NMC revalidation process, a regulatory requirement for all nurses and midwives in the UK. The keyword purpose focuses on the underlying reason for this mandatory process. Revalidation is designed to ensure that nurses and midwives reflect on their practice, engage in continuing professional development, and receive feedback to confirm they continue to meet the professional standards of the NMC code, thus protecting the public. For example, a nurse needs to collect 450 practice hours and 35 hours of continuing professional development over 3 years to show they are actively learning and practicing. Always remember that revalidation is about demonstrating your ongoing commitment to safe and effective patient care. Question 15. A patient has expressed concern about their personal data being shared. Which principle of the NMC code should guide the nurse's response? A. Promoting public health. B. Always promoting professional development. C. Respecting people's right to privacy and confidentiality. D. Working cooperatively with colleagues. Answer: C. Respecting people's right to privacy and confidentiality. This question highlights the critical ethical and legal principle of patient data protection. The phrase personal data being shared immediately brings to mind confidentiality and privacy. The NMC code clearly states that nurses must respect people's right to privacy and confidentiality, which means safeguarding personal information and only sharing it when absolutely necessary for care, with consent, or when legally required. For example, you should never discuss a patient's medical history in a general ward area where others might overhear. Always remember that maintaining confidentiality builds trust and protects the patient's dignity. Question 16. A nurse is asked to perform a procedure that they are not competent to do. According to the NMC code, what should the nurse do? A. Attempt the procedure anyway to avoid looking incompetent. B. Refuse to perform the procedure and immediately report the request to the manager. C. Seek assistance from a more experienced colleague and learn on the job. D. Decline the task and explain that they are not competent, seeking appropriate training or delegating to a competent colleague. Answer: D. Decline the task and explain that they are not competent, seeking appropriate training or delegating to a competent colleague. This question addresses professional accountability, competence, and patient safety. The crucial phrase, not competent to do, means the nurse lacks the necessary skills or knowledge. The NMC code requires nurses to only undertake tasks for which they are educated, trained, and assessed as competent, and to recognize the limits of their practice to protect patients from harm. For example, if asked to insert a central line without prior training, the nurse must decline and explain why, then help find a colleague who is competent to perform the procedure. Always remember that patient safety always comes first, and it's your professional duty to know your limits and act within them. Question 17. In a healthcare emergency, such as a fire, what is the nurse's primary responsibility? A. To gather all patient records for safekeeping. B. To ensure the safety of patients and staff, following the RACE protocol: rescue, alarm, contain, extinguish/evacuate. C. To direct visitors to safety. D. To wait for instructions from emergency services. Answer: B. To ensure the safety of patients and staff, following the RACE protocol: rescue, alarm, contain, extinguish/evacuate. This question tests your knowledge of emergency procedures and prioritization in a critical situation. The keywords healthcare emergency and primary responsibility direct you to the most important action. The nurse's immediate priority in an emergency like a fire is to ensure the safety of patients and staff by following established protocols such as RACE, which systematically addresses immediate hazards and evacuation. For example, rescuing patients from immediate danger is always the first step. Always remember that in an emergency, patient and staff safety takes precedence over all other tasks, and knowing your emergency procedures is crucial. Question 18. What is the significance of the duty of candor in nursing practice? A. It requires nurses to report all patient complaints to the NMC. B. It mandates that nurses must be open and honest with patients when something goes wrong with their care. C. It encourages nurses to only admit mistakes if directly asked. D. It obligates nurses to apologize for errors even if they were not at fault. Answer: B. It mandates that nurses must be open and honest with patients when something goes wrong with their care. This question assesses your understanding of the duty of candor, a fundamental principle of ethical and professional practice. The keyword significance highlights the importance of this duty. The duty of candor requires healthcare professionals to be open and honest with patients and their families when something has gone wrong with their care that has caused, or has the potential to cause, harm. For example, if a patient receives the wrong medication, you must explain what happened, what is being done to rectify it, and what steps are being taken to prevent it from happening again. Always remember that being open and honest builds trust and helps patients feel respected, even when errors occur. Question 19. A nurse is observing a colleague who is delegating a task to a healthcare assistant, HCA. What is an important consideration for safe and effective delegation? A. The nurse should delegate tasks that they do not enjoy doing. B. The nurse must ensure the HCA is competent to perform the delegated task. C. The nurse should delegate without providing specific instructions. D. The nurse can delegate any task, as long as the HCA agrees to do it. Answer: B. The nurse must ensure the HCA is competent to perform the delegated task. This question focuses on the principles of safe delegation, a key aspect of nursing leadership and team working. The keywords important consideration and safe and effective delegation point to the core responsibility of the delegating nurse. When delegating a task, the registered nurse retains overall accountability for the patient's care and must ensure that the person they are delegating to has the necessary skills, knowledge, and experience to perform the task safely and effectively. For example, before asking an HCA to take a patient's blood pressure, the nurse must confirm the HCA has been trained and is competent in that specific skill. Always remember that delegation is about safely distributing workload, not just passing off tasks, and requires careful assessment of the delegate's competence. Question 20. What is the main purpose of applying the principles of person-centered care? A. To complete all care tasks as quickly as possible. B. To provide care that is tailored to the individual's needs, preferences, and values. C. To ensure all patients receive the same standard package of care. D. To reduce the amount of time nurses spend talking to patients. Answer: B. To provide care that is tailored to the individual's needs, preferences, and values. This question tests your understanding of person-centered care, a fundamental philosophy in modern nursing. The keyword main purpose highlights the core objective. Person-centered care involves recognizing each patient as a unique individual and designing care around their specific needs, preferences, values, and circumstances, promoting their involvement in decisions about their health. For example, instead of assuming all patients want breakfast at 8 a.m., a nurse practicing person-centered care would ask the patient their preferred time or if they have any dietary restrictions based on culture or religion. Always remember that true quality care is not uniform, it's customized to the individual. Question 21. A nurse is documenting an incident where a patient had a fall. Which characteristic is essential for this documentation? A. It should be subjective and include the nurse's personal opinions. B. It must be completed several hours after the incident to allow for reflection. C. It should be factual, objective, accurate, and completed contemporaneously. D. It needs to include blame and identify who was at fault for the fall. Answer: C. It should be factual, objective, accurate, and completed contemporaneously. This question focuses on the principles of good record keeping, especially in critical situations. The keyword essential highlights the critical qualities of incident documentation. Documentation related to patient incidents, like a fall, must be factual, what happened, objective, without personal bias, accurate, correct details, and contemporaneous, recorded at or near the time of the event, to ensure it serves as a reliable legal and clinical record. For example, instead of writing "patient was clumsy and fell," you should write "patient found on floor next to bed, stating I slipped." Always remember that clear, objective, and timely documentation is vital for patient safety and accountability. Question 22. Which ethical principle is primarily upheld when a nurse acts to prevent harm to a patient? A. Autonomy. B. Justice. C. Beneficence. D. Non-maleficence. Answer: D. Non-maleficence. This question tests your understanding of fundamental ethical principles in healthcare. The keyword prevent harm directly correlates with one of the core ethical duties. Non-maleficence is the ethical principle that requires healthcare professionals to do no harm, and to prevent harm from occurring, which is a foundational duty in all nursing practice. For example, ensuring that a patient's bed rails are up to prevent them from falling is an act of non-maleficence. Always remember that preventing harm is a primary responsibility that guides many of your daily actions in nursing. Question 23. A nurse is caring for a patient from a different cultural background. What is the most important approach for the nurse to adopt? A. Assume the patient's cultural beliefs are the same as their own. B. Provide care according to standard protocols without considering cultural variations. C. Research the patient's specific culture extensively before providing care. D. Demonstrate cultural sensitivity by asking about and respecting their cultural beliefs and preferences regarding care. Answer: D. Demonstrate cultural sensitivity by asking about and respecting their cultural beliefs and preferences regarding care. This question addresses the importance of cultural competence and sensitive care, a key aspect of person-centered practice. The phrase "most important approach" directs you to the most effective way to engage with diverse patients. Demonstrating cultural sensitivity involves acknowledging and respecting a patient's unique cultural beliefs and preferences, and actively seeking to understand how these might influence their health decisions and care needs. For example, instead of offering pork to a Muslim patient, a culturally sensitive nurse would inquire about dietary restrictions or preferences. Always remember that respecting a patient's cultural background fosters trust and improves the quality of care. Question 24. What is the legal framework that protects patient information in the UK? A. The Human Rights Act. B. The Data Protection Act and GDPR. C. The Mental Capacity Act. D. The Access to Health Records Act. Answer: B. The Data Protection Act and GDPR. This question tests your knowledge of the legal requirements for patient data protection in the UK. The keyword legal framework and protects patient information directly point to the relevant legislation. The Data Protection Act, DPA, and the UK General Data Protection Regulation, GDPR, are the primary legal frameworks that govern how personal data, including sensitive health information, must be handled, stored, and protected in the UK. For example, this legislation dictates that patient records must be kept securely and only accessed by those with a legitimate need. Always remember that respecting patient privacy is not just an ethical duty, but also a strict legal requirement. Question 25. A patient complains of sudden, severe chest pain. What is the nurse's immediate priority? A. Administer pain relief as soon as possible. B. Document the patient's complaint thoroughly. C. Assess the patient using an ABCDE approach and escalate concerns appropriately. D. Contact the patient's family to inform them. Answer: C. Assess the patient using an ABCDE approach and escalate concerns appropriately. This question focuses on rapid assessment and prioritization in a potentially life-threatening situation. The keywords sudden, severe chest pain indicate a medical emergency, and immediate priority directs you to the most critical initial action. When faced with a patient experiencing acute symptoms like severe chest pain, the nurse's first step is to conduct a rapid, systematic assessment using the ABCDE approach to identify and manage immediate threats to life, and then escalate concerns to the medical team for further intervention. For example, checking their airway, breathing, and circulation takes precedence over giving pain relief or documenting. Always remember that in acute situations, a systematic assessment of vital functions is the quickest way to identify and address life-threatening issues.